Artificial intelligence in personal health. The new platform and opportunity. In general, our solution helps to integrate personal AI with business AI. We introduced the new platform, allowing much more efficient interaction between consumers and providers. The foundation of our platform is patented artificial neural networks, which allow us to integrate various functional components into dynamic configurations. Healthcare is the most common, and at the same time most sophisticated area of human interest. If we manage to create a virtual assistant for personal health, this solution can be easily adapted to other applications. Our goal will be 3 constituent elements of personal health: clinical diagnostics, personal medical diary, and assignments. Our personal virtual assistant can significantly improve self-care, and at the same time, it helps to interact with doctors and makes clinical diagnostics more efficient. An interview is one of the most important parts of the healthcare process. In clinics, general practitioners are at the front of the process, and their time is limited. One of our goals is to provide improvement of the doctor-patient interaction by increasing its efficiency. The purpose of the typical interview is to collect sufficient information to make a decision. Collecting information, or anamnesis, normally consists of 3 parts: introduction, subjective findings, and objective findings. Diagnosis is a conclusion based on various decision-making techniques. Objective findings and diagnosis are critically dependent on the presence of the doctor. But the subjective findings essentially is a dialogue when the doctor asks questions, following a well-known protocol. Using our platform, such dialogues could be conducted before the interview, without the doctor. And the formal result will be presented to the doctor when needed. Let's assume that 20 minutes of the average interview is distributed in such proportions, and subjective findings took about 6 minutes. If the dialogue about subjective feelings is conducted before the interview, it may save about 3 minutes of the doctor's time, which can be used for better diagnosis. Simple estimation gives us approximately 1 hour per day, which we can save for the average general practitioner. The very first version of the neural network-based dialogue interpreter was developed at Boston University and Simferopol State University during 1987 to 1995. This HyperCard stack helps to make medical decisions based on Professor Toscan's score system of abdominal problems. In this example, the next question generated automatically, based on the assumption that it is the most probable one which the doctor should ask, considering the information previously collected. At any particular moment, the system recalculates the probability of a disease and chooses the next question until it reaches the threshold level of diagnosis. The foundation of this diagnostic system is 3 sets of data. Symptoms, questions, and diseases are based on expert knowledge. Questions are symptom criteria associated with possible answers expressed by the patient. A combination of answers allows selecting the most probable disease according to an expert score. These sets are implemented in form of artificial neural networks, and the state of this ANN reflects the state of the conversation. Diagnostic models, based on artificial neural networks, show incredible adaptability and compatibility. And voice recognition is widely available now, and makes dialogue significantly more efficient.
Now, let's see an example of how all this works in practice. Alexa, ask my doctor.
Welcome.
I'm taking new medication.
Are you taking any antibiotic or antihistamine?
Yes, I am.
What did you take?
I took penicillin.
What day did you begin taking this medication?
On Monday.
That was an experimental system to gathering personal subjective data inside the smart home environment, developed by a group of UMN students in 2015. Another important component of an integrated healthcare system is a personal medical diary. Sometimes, practitioners may require patients to keep a health journal. Some people like to keep records about their physical or mental health. But everybody agrees that a medical diary could be very helpful to the patient and to a doctor. We introduce Smart Health Diary, which is 100% private, and at the same time is capable to analyze inputs on the fly, label records, use various input devices from Alexa to Apple Watch, and share information with doctors by using various communication protocols and data formats.
How long have your headaches been going on?
About a week.
How about sleep? Are you getting enough rest?
I think so. My blood pressure today is 140 by 80.
My blood pressure today is 140/80.
And I had headache this morning.
And I have a headache this morning.
In our health diary, all data stays inside the personal cloud. Instead of sending private data to the provider for analytics, we download models on demand and applying them locally. There are 5 major types of models, currently supported by our platform: image classifiers, NLP, artificial neural networks, functional actions, and contextual dialogues. Assignments are an important part of the healthcare process. An assignment could be a recommendation or a procedure for physical or mental health improvement. Daily tasks, such as a diet or advice that can motivate an individual, could be considerably helpful, especially if they are personalized. Our platform includes proprietary authoring tools, we call it cards, which allow the creation of content such as challenges, tips, updates, and other nudges, capable to interact with a local personal environment. What makes our solution different and competitive from hundreds of applications, which are already on the market? The typical personal medical assistant application or service is based on client-server architecture, and the data collected during the session is transferred to the cloud. The patient's data then transferred to the doctor for control and decision-making. But there are too many applications to choose from. Finding the proper one, when needed, is a big problem. Each application keeps data on its own cloud server. And these servers do not communicate with each other. Expert knowledge models are not expandable and shareable. And more. Our solution solves most of these problems. First, it could be integrated into major virtual assistants like Alexa or Siri, and expand their functionality. And second, because neural networks keep content, context, and dialogue models locally, many problems, such as the state of the conversation, privacy, models update, and more, are resolved automatically. For years, Nuance, Microsoft, IBM, and other companies have been creating AI tools for doctors. We believe that now, it is time to build AI tools for patients. With this presentation, we invite business people, investors, and medical experts to make personal AI a reality all around the world. Please contact us if you share our passion.